Hi, welcome back to LP Human Anatomical. Part of anatomical terminologies. I will discuss on the various terminologies on the relations of the structures present in the body. If you have not gone through the first part of anatomical terminologies on introduction, subdivisions and planes, I recommend you to go and watch it. Now coming to the terms in relation to head, neck and trunk, ventral or anterior, okay, ventral or anterior is the part, okay, so here this is the ventral or the anterior part which is the front of the head, neck and the trunk region, okay. Dorsal or posterior is the part behind, that is posterior part, okay, back of the head, neck and the trunk. Now for example, here you can see if the structure is present close to the anterior part, okay, so A is anterior in relation to the structure present posteriorly, that is B, okay, close to the posterior part of the body. So any structure present close to the anterior part when compared to a structure which is away from the anterior part and close to the posterior part, okay, becomes anterior. So here A is anterior to B, okay, and B is posterior to A. Now another example to take here, okay, the F and I. Now F will be anterior and I will be posterior. Now if we take G, compare these three structures. F is anterior to G, I is again anterior to G. Okay, so G is posterior to I and F, okay, both the structures. So that is anterior and posterior. Now cranial or superior, cranial or superior is close to the head and caudal or inferior is close to the lower end of the trunk or towards the feet, okay. Now here to take the example of A and F, okay, A is cranial or superior to F and F is inferior to A or caudal to A, okay. The same way B and G, B is cranial, G is inferior or caudal. Superficial is the structure which is close to the skin of the body or the surface of the body, and deep is the structure is deep away from the skin or the superficial part of the body, okay. So G is close to the surface or the skin of the body and I is deep inside the body, okay, away from the surface or inside the body, okay. So you can imagine I as the deeper part of the body. Now lateral is the plane, okay, lateral is the plane away from the median plane or the midline, okay. So that is the midline or the median plane. So lateral, the structure present away from this midline is lateral then the structure close to the midline is medial. We call it as medial. So here comparing C with H, okay. H is the lateral relation to the structure C, okay, to the structure C, and C is medial to the structure H, okay. So you can see H is away from the midline, C is close to the midline. Now ipsilateral, the same example C and H, they are present to one side of the midline, okay. It is present to one side of the midline. So that is called as ipsilateral. Now contralateral is when the structures are present on the opposite side of the midline, okay. So here when we take C, H and D, what happens? D is present onto the right side and CH is present on the left side of the body. So C and D are contralateral, H and D are contralateral, C and H are ipsilateral. Okay. Now infiromedial. Infiromedial is that relation of the structure which is both inferior and medial to the adjacent structure, okay. And inferolateral is that structure which is both inferior and lateral to the adjacent structure. Now here to take the example of C, H and E, E is inferior to both the structures, but if you can see it is in the middle of these two structures. Now to compare with H, E is inferior to H and also it is medial to the H, okay. It is closer to the midline compared to H, okay. So E is inferomedial to H. Now if we compare E to C, E is inferior to C and at the same time it is away from the midline, so it is lateral to C, okay, when it is compared. So E is inferolateral to C, okay. Now superolateral. Superolateral is the structure which is superior and lateral to the adjacent structure. Superomedial is the structure which is superior to the adjacent structure and it is also medial and close to the midline than the adjacent structure. So to compare here with the same example C, H and E, now C is, okay, C is superior to E and it is close to the midline, okay, than compared to E. So this relation we call it as superomedial. So C is superomedial to E and H and E, okay, if we take H is superior to E and also since it is away from the midline compared to E, okay, so the distance of H from the midline is more compared to the distance compared, okay, with that of the distance from midline to E, okay. So H is superior and it is lateral to E. So it is the superolateral relation to E. Okay. So H is superolateral to E. Okay. So that is how we see the relationship between two structures, three structures, okay, even four structures Okay, any number of structures can be related with each other. Okay, so let us see the terms in relation to upper limb, how it is different from that of the head, trunk and face. Now here in the limb, okay, in the upper limb, so each region, some terminologies will differ. So in the upper limb, ventral or anterior is front aspect of the limb. Okay, when we see the side view, in the anterior view or posterior view, we will see only the one aspect, okay, of the upper limb, whether anterior or posterior, okay, medial or lateral. So in respect to the position of the limb. Now in the side view here in this picture, okay, ventral or anterior is the front of the upper limb. Okay, so and dorsal or posterior is the posterior part of the upper limb. So this side view, when we check the side view of the upper limb, here A is anterior, okay, and F is anterior. Okay, A and F is anterior, is present on the anterior aspect of the upper limb, but B and E are posterior. Okay, they are present in the posterior part of the upper limb. Here, when we see the anterior view, okay, when we see the anterior view, the same part of the upper limb which is facing anterior here, when the arm is to the side of the body and when we see from the side, okay, here in the anterior part it becomes, okay, it is directed superiorly and inferiorly, but still, okay, just focus here, but still, since we consider the relations in the anatomical position of the body, okay, even if the upper limb is abducted from the body, okay, and the anterior portion of the upper limb is directed superiorly, still we consider A as anterior and B as posterior. Okay, so the structures whichever is present towards this region, okay, anteriorly, it is considered in the anatomical position. You have to imagine the anatomical position and then, okay, you have to tell what is the relationship, okay, between two structures. Okay, so that is clear. I hope this is clear. Okay, now medial border is, or the medial aspect of the upper limb is the side where it is present towards the little finger of the body. Okay, so here you can see the little finger is facing, which is facing anteriorly. Okay, so that becomes the, okay, so that becomes the medial side of the upper limb. Okay, so that is, I hope that is clear. So here in the side view, when you see, okay, when you see this, the side of the upper limb, what we are seeing here, okay, the side of the upper limb, what is seen is the medial view, but it is the lateral side of the upper limb. Now here in the anterior view, which is on the left side here, okay, what we are seeing is the medial view. Okay, so that is the medial view here. Okay, so in the anterior view, depending on the position of the upper limb, okay, when the upper limb is abducted, okay, taken away from the body, we can see the medial side of the upper limb. And here when the upper limb is close to the side of the body in the adducted position, okay, so that is the medial side of the upper limb or the medial border of the upper limb. Okay, so the whole thing here, what we are seeing is the anterior aspect of the upper limb. Okay, so that is the medial. Now the lateral part of the upper limb is already discussed here in the side view. Whatever we are seeing is the lateral view of the upper limb. Okay, lateral side of upper limb. Now in the anterior aspect in the middle picture, we are not able to see the lateral aspect. It is on the opposite side, okay, directed posteriorly, that is towards the thumb. We can see the thumb here. So this region is the lateral aspect, and here in the picture which is on the left side, that is the lateral aspect of the upper limb. Now what is proximal and what is distal? Okay, proximal is close to the attachment of the limb. Okay, so we call this as root of limb. So when the structure is close to the proximal part or the root of the limb, we call it as proximal. Okay, distal is the part of the upper limb which is present close to the hand, okay, or the fingers. So whatever structure present towards the fingers, okay, we call it as distal. Now when we take the relation with the A and F, okay, the two structures A and F, A is proximal, okay, it is closer to the root of the limb, and F is away from the root of the limb, okay, when compared with two structures. Okay, when you are comparing two structures, the structure which is away from the point of relation, if it is far away from the other structure, then we call it as distal. Okay, and the structure close to that point, okay, we call it as proximal. Okay, so A is close to the root of limb or proximal part of the limb, F is away from that, so F is called as distal. Okay, same with B and E. B is proximal, E is distal. To look at the flexor aspect of the upper limb and the extensor aspect. Now front part of the upper limb is the flexor aspect. Okay, so flexor aspect and anterior part is same. So here, okay, you can see in the middle picture, okay, with the upper limb abducted, F is directing superiorly, okay, the flexor aspect is directed superiorly, and the extensor aspect, that is E, is directed inferiorly. Okay, okay, so that is the extensor aspect. Is that clear? Okay, So here, okay, R is that aspect, okay, that aspect of the palm, okay, this is the palm, and this is the dorsum of the hand. That is, posterior aspect of the hand is the dorsum. Even if it is directed downwards, we call it as posterior aspect of the hand or the dorsum. So Q is present towards the dorsum of the hand and R is present towards the palmar aspect of the hand. Okay, so structure close to the surface of the palmar aspect, we call it as palmar aspect or anterior aspect of the palm. So R is palmar aspect, Q is dorsum of the hand. Coming to the relations, okay, terminologies in relation to lower limb. The anterior aspect of the lower limb is that part which is directed anteriorly. So here in the anterior view, okay, so the part which is visible in this picture to us is the anterior part, okay. So, or the ventral part of the upper limb, lower limb. Now, the posterior aspect in this anterior view is not seen, okay. This is behind the part. We have to see from the posterior view of the body. Now here in the side view, okay, in the side view, so that part here which is towards the feet, okay, is the anterior aspect of the lower limb, okay. So here A is present on the anterior part of the lower limb and B is towards the posterior aspect of the lower limb. So when we compare the relationship between A and B, A is anterior to B and B is posterior to A, okay. So same way here, A is anterior to B, B is posterior to A, okay. Now coming to the relations medial and lateral, okay, medial border or the medial side of the lower limb, it lies along the big toe or the hallux or the foot, okay, medial side of the foot. So the structures which are present close to the medial border of the foot, medial border of the leg and the thigh, okay, is the medial side or medial relation of the structure. Now lateral border or the lateral side of the lower limb is that part of the lower limb which is present towards the little toe, lateral side of the foot, lateral side of the leg and the thigh, okay. So that is the lateral side of the leg. So when we compare the structures in the side view here, okay, we are seeing the lateral side in one leg and medial side in the other leg, okay. So here we are seeing the lateral side of the leg here, okay, because we are viewing it from the little toe, okay. Now in the other leg here, okay, in the other leg here, we are seeing the great toe, okay, we are viewing it from the great toe here. So this is the medial aspect of the leg, okay. So I hope that is clear. Okay, so from the front view, M is medial, L is lateral. Okay, when observed here in the anterior view of the body. Okay, so side view we have discussed, we can see only one view. Okay, only one view of the lower limb. Okay, so from side we can either see the left side or the right side of the lower limb. Now, what is proximal and what is distal? Proximal is close to the root of the lower limb. Okay, so you can see that is which is attached to the trunk. Okay, the part which is attached to the trunk. Okay, that is the proximal part of the lower limb. And the free part where the foot is present, we call it as distal end of the lower limb. So here, okay, P is proximal, D is distal. The same thing when we compare between the A and D, okay, A is proximal to D. Clear? A is proximal to D and D is distal to A. If I compare another structure here, O, okay. So when we compare the three structures here, A, O and D, A is proximal to O and D, O is proximal to D, O is distal to A and O is proximal to D. Okay, and D is distal to both A and O. Okay, I hope this is clear. Coming to the flexor and the extensor parts of the lower limb, flexor aspect is present on the posterior aspect of the lower limb. Okay, so that is the flexor aspect of the lower limb, and extensor part is directed anteriorly, okay, towards the lower limb. So if you can recall, in the upper limb, flexor part was present towards the anterior part of the upper limb and extensor part was present or directed towards the posterior aspect of the upper limb. But here it is opposite. Flexor part is present on the posterior aspect of the upper limb and the extensor part is present towards the anterior region of the lower limb. So what is the reason for this is, okay, this is due to the development, okay, occurring in the embryological period or the developmental period where the limb is rotated, okay, 90 degrees to one side. Okay, the limb bud, it starts as a limb bud, very small, tiny, minute structure. Okay, we call it as the limb bud. So this limb bud, as the development occurs, it rotates to one side of the body. Now, the rotations in the upper limb and lower limb is in opposite directions. Okay, where upper limb rotates laterally 90 degrees and the lower limb rotates medially 90 degrees. So, hence the difference. Okay. Now, we will see what are the terms used in embryology and comparative anatomy. Okay. Ventral is the part directed towards the belly, okay, or the anterior part of the body. Dorsal is the part which is directed towards the back or directed posteriorly. Cranial or rostral is that part which is directed towards the head or directed superiorly, and caudal is directed towards the tail or directed distally. Okay, so these are the terminologies used during the developmental stage. Okay, so ventral otherwise is anterior, but we don't in the during development we don't call it as anterior posterior. Okay, but in adult stage after birth we can use ventral dorsal cranial caudal, but we don't use superior inferior usually. Okay, these are the describing terms in the developmental stage of the individual. Okay, so that is about the terminologies on the relations. Okay, so until now I discussed about various terminologies related to the structures in various regions of the body. Okay, so in the third part I will discuss on terminologies pertaining to body movements. Thank you. Okay, see you in the third part of anatomical terminology. If you like the video, hit the like button. If you have not yet subscribed, subscribe to the channel and hit notification button. Join my private Facebook community where like-minded students will support, discuss, encourage and push each other towards reaching the goal. For link, visit the description area. Thank you for watching.